Assalamu alaikum doctors. In this video I am discussing about the Wilson's disease. So Wilson's disease is not it's common history, not that much common. It comes on development, very important. The task can be like that: child is 8 years with seizure and developmental regressions. Child 8 years with delayed school performance. So remember, developmental regressions, delayed school performance. One of the top DD is Wilson's disease and 8 years age old. First, we have to analyze the chief complaints. If seizures should be analysis first. Describe the event. Video recording. What happened once or recurrent occur. What happened before? Any psychic trauma, any fever, bugs in the brain. Then what did you do for that? What happened after? So before, during, after we ask OCD, first time or recurrent video recording. Then regressions in the form of what? What did he do before and now cannot? Any unusual behavior at school or at home? What about his intellectual activity, visual or auditory hallucinations? Strange or unusual pattern of talking like dysarthria. Okay, and so regression, what he before do, what he cannot do, what is his behavioral abnormality, what about his speech, any visual or auditory hallucinations, these are. What about the talking pattern, is there any strange or unusual pattern of talking for dysarthria? General, is he look like you and his daddy? Any concern, any other concerns, any chronic disease or a long-term medical conditions? Then FWASL, fever, weight loss, appetite, sleep and activity. Then systemic review one by one from CNS, symptoms of increased ICP, seizure, abnormal movements, eye abnormality, disturbance in vision and hearing, unusual pattern of walking and change in mood. GIT about the increased tummy size, tummy pain, loose poo, yellowish discoloration of eyes. MSK, bone pain, joint pain or swelling, skin spots, skin lumps, color of hair, nail and bow legs. Urinary about the pee amount, color, odor, painful peeing and control, blood pressure measured. Endocrine about the thyroid, Addison, salt craving, postural hypotension, skin pigmentation in sun exposed areas. Then we go the respiratory, preceded any sore throat, recurrent bugs, noisy breathing. As usual, we ask everything. Hematology, pallor, bleeding, recurrent bugs. CVS about the heart racing, exercise intolerance and fainting attacks. Now we are going to the past history 5T IOA, the drugs, travel, hospital admission team following with perinatal history like maternal disease, maternal drugs during pregnancy, type of delivery, birth weight, first cry, NICU admissions, heel prick test and ULH after birth. Development about the gross motor, fine motor, speech, social and the growth chart. Then we go the vaccination history, like did he miss any of his shots, any extra shots, any recent shots. Nutrition, who prepare it, feeding problem, special type of diet, Wilson disease, avoid selfish nuts and chocolates. So remember, in Wilson disease, diet history is very, very important because avoid selfish nuts and chocolate. Maybe the child has history of nuts and chocolate taking too much nowadays and his features develop. Allergy to the certain food or drugs, family consanguinity, similar condition, repeated abortions or sudden infant death, social or financial home like old painting, old pipes, always any regressions, old painting, old pipes, school or school attendance, school performance and bullying issue, psychological and impact. DD of regression, remember I am telling, less than 2 years with hepatomegaly, we can tell glycogen storage disease, Gaucher disease, mucopolysaccharidosis, galactosemia, Niemann-Pick disease and Jewelers syndrome. Without hepatomegaly, Rett syndrome, Menkes disease, phenylketonuria and maple syrup urine disease. Okay. 2 to 5 years we can go Wilson disease, ataxia telangiectasia, adrenoleukodystrophy, metachromatic leukodystrophy, Niemann-Pick, Refsum disease and juvenile Huntington. 5 to 16 years Wilson disease, ataxia telangiectasia, adrenoleukodystrophy, SSP, subacute sclerosing panencephalitis, multiple sclerosis, Friedreich ataxia, juvenile Huntington and psychological. Other DD of abnormal behavior I am telling, neurological or degenerative condition, Wilson, ataxia telangiectasia, juvenile Huntington, adrenoleukodystrophy, metachromatic adrenoleukodystrophy and Niemann-Pick. Endocrine or hyperthyroidism and hypoglycemia. CNS about the brain tumor, infection, trauma, stroke, hypoxia, autoimmune or SLE, PANDAS, Hashimoto encephalopathy, SSP, and syndromics like lead poisoning, drugs or levetiracetam, psychological bullying and NAI. So this is about Wilson disease. Remember history, how can we take, and we know there is chromosome number 13, ATP7B gene. They have jaundice. The child, what are the features in Wilson disease we find? First of all, sudden developmental regression, school performance is very bad, fits, seizure problems, eye problems. They have eye, Kaiser Fraser rings, jaundice, hepatomegaly. These are then these are the features of Wilson's disease. Thank you.